If you're watching this video, your eye doctor may have recommended one of our treatments to help conditions like dry eye, meibomian gland dysfunction, ocular rosacea, and so much more. The first treatment is called TempSure Envi by Cynosure. This is a radiofrequency or heat treatment that we use to liquefy the oils in your oil glands. Sometimes with dry eye, when the oil glands get clogged, the oils tend to solidify, like putting butter in a fridge. When that happens, when you're blinking, if the oils are too hard, the oil glands will be unable to release the oils to lubricate your eyes. So you need a treatment like TempSure to liquefy the oils in your oil glands, turning it into a nice olive oil consistency so that when you blink, the oils will get released by the oil glands to lubricate your eyes. When you come in for your treatment, we'll first wipe your skin around your eyes, making sure there is no traces of makeup, moisturizer, or any debris that could be on your skin. We'll then apply an ultrasound gel around your eyes because TempSure is a very repetitive movement and we don't want any friction on your skin. We'll then start the treatment by massaging this handpiece around your eyes for about 5 minutes on each side. The treatment feels really good, almost like a hot stone massage. But although TempSure is comfortable, you could have some side effects. The first one is a little bit of redness around your eyes. This is not irritation, it's just caused by the heat, like a little flushing, and will go down within 20 minutes after the treatment. The second side effect is called bruising. You're not going to be left with large blue or purple patches around your eyes. It will look more like tiny red dots. Those will go down within a day or two, and you can apply concealer or makeup if you're concerned with your appearance. People on blood thinner, with thinner skin or more prone to bruising are more at risk of bruising with a TempSure treatment. The third side effect is called hot spot. Now, hot spot can be a little uncomfortable. It can feel like you're touching a curling iron or the stovetop, but it's not a real burn. It's just very deep heat that feels much warmer than it is. We're staying at 42 degrees Celsius, not enough to create a real burn. As soon as we release the handpiece, you won't feel anything. You're not going to have any blisters or lingering pain that you would have with a real burn. Your feedback is very important because TempSure is designed to be very comfortable. If we see bruising or you have a hot spot or you feel like the treatment is just getting too uncomfortable, let your service provider know. We can adjust the settings for your skin type. Now, adjusting the settings doesn't mean you will have a lesser treatment. It's the 42 degrees Celsius that gives us the heat that we need to liquefy the oils in your oil glands. When we change the settings because it's uncomfortable, we're simply making it more comfortable for your skin type. Another treatment your eye doctor may recommend is called IPL. IPL stands for Intense Pulse Light. The purpose of IPL is to reduce inflammation in the blood vessels surrounding the oil glands. When left untreated, that inflammation can contribute to clogging your oil glands and worsening conditions like meibomian gland dysfunction, ocular rosacea, or styes. When you come in for your treatment, we'll first wipe your skin, making sure there's no traces of makeup, tinted sunscreen, moisturizer, or any product that could be left on your skin. We'll then cover your eyes with specifically designed IPL shields to make sure that the light doesn't get in your eyes. But IPL is a very bright treatment. So if during the treatment you see a flash of bright light, do not worry. The light is not getting in your eyes, it's simply traveling around your eyes, but it's not getting, again, in your eyes. We'll then apply ultrasound gel under the shields to cool your skin and create a nice barrier between your skin and the light. We'll then conduct a test spot. We want to make sure that you don't have any adverse reaction. We'll be looking at reactions like blistering, severe redness, or inflammation. If you don't have any adverse reactions, that means we're good to go. We'll then start the treatment, and we'll take the IPL device and pulse the light under your eyes, and we'll do both sides in 2 passes. IPL is fairly comfortable. Some patients say they experience like a mild rubber band snap on their skin. You could also experience some side effects after the treatment. Although rare, when you do an IPL treatment, you're always at risk of symptoms similar to a mild sunburn. When we have a mild sunburn, our skin might feel a little warm, we may see some mild redness or mild inflammation. So if you experience any of these symptoms after an IPL, cool your skin as if you had a mild sunburn. Use a cool compress for 10-20 minutes and your side effects should be gone in no time. If you do have some redness or inflammation, keep cooling your skin and your skin should resume to normal the next day. After the treatment, we'll apply a cooling and soothing cream around the eye area. We'll also apply an SPF. After the treatment, it's really important that you avoid sun exposure because an IPL treatment can make your skin more prone to sunburn for about a week after the treatment. If you cannot avoid sun exposure, it's imperative that you wear an SPF of at least 30 and wear your sunglasses.
You might be wondering, how often should I do those treatments? At the beginning, we recommend a series between 3 and 5 treatments, depending on the severity of your symptoms. After your 3rd treatment, we'll send you back to your eye doctor for a follow-up visit. They'll look at your oil glands, they'll make sure the treatments are working properly, and they'll also decide on a maintenance plan. A maintenance treatment is one treatment done either quarterly or every 6 months, again depending on the severity of your symptoms. This will ensure that you keep your symptoms under control. If you have questions or concerns about a dry eye treatment, give your eye doctor a call and let's get you scheduled today.